Good evening, and welcome to Penn State Fayette. I am Dr. Joe Jankowski. I'm the Associate Professor here in Human Development and Family Studies. Once again, we're very blessed to be partnering with our community partner, Fayette County Drug and Alcohol, to bring this presentation to you. It is an awesome presentation. Was part of the presentation when it was held down in Connellsville High School several weeks ago. Wonderful information that I was not aware of. So to have this distinguished panel that we have here tonight, we are very blessed. We're very blessed to have these individuals in Fayette County because it's going to take all of us to make a change. But without further ado, I would love to introduce you to a friend and colleague. She is the administrator of Fayette County Drug and Alcohol. Jana?
Thank you, and as Joe has said, we are so blessed to have everyone here willing to listen, learn, and participate in such an issue that is affecting all of us, whether it affects us directly or it affects somebody that we know or love. I would like to take this moment to let you know that this has been a process that has been in play for several months. We have been doing a series of these in the fall to get out to the communities to talk about local issues regarding prescription drug abuse. We decided to do one more community countywide forum to deal with this issue because the issue does not go away. We have been very happy to have our local newspaper do a series of articles on the different aspects of addiction, and prescription drug abuse is one aspect that leads into several areas of addiction. So we want to bring this into play. We're going to give everybody an opportunity, if you would like, to participate after the panelists have had their moments to discuss the issues from various perspectives. And I don't want to stand here forever, so I am going to turn this over to Mr. Mark O'Keefe, who is going to be our moderator for the event.
Okay, thank you very much. The event tonight is titled Prescription Drug Abuse, The Cost of Getting High, presented by the Fayette County Drug and Alcohol Commission. Our keynote speaker for this evening will be Secretary Gary Tennis from the Department of Drug and Alcohol Programs. And after he speaks, we'll have a question and answer session with our panelists, and then we'll open the floor to questions from the audience. First of all, though, we do have a number of public officials here that we want to acknowledge. We have Fayette County Commissioner Angela Zimmerling.
Welcome to this evening's presentation. I want to thank our keynote speaker for coming here today to participate and to give us, share with us his experience and his knowledge that I'm sure is going to be very invaluable to share here with Fayette County. Tonight's presentation, obviously, as you all can see, says prescription drug abuse. But look at the words right underneath it. The cost of getting high. And that's the important part of, in my opinion, and the important part of this presentation is the cost of getting high. It's not just the cost to the family anymore, the immediate family. It's a cost to society as a whole. It's a cost to Fayette County. It's a cost on our government, operations and cost, on our economics, and on our social well-being. It increases crime. It increases the cost for us to operate our government for treatments and programs. And it encompasses in so many ways from one end of the spectrum to the other how it can affect us on a social level. And that's why it's important that we all understand. First off, you've got to recognize and identify the problem. But then it's much more than that. Since it affects all of us in one area or the other, we all have to be part of the solution. And that's the important part today, is to listen to all of these panelists here today and to not only say, yeah, we have a problem, and we've recognized what the problem is, but what are we going to do about it? Because it may only affect you in a small amount, maybe only you in a small amount, maybe you only 50% of your life, you 100% of your life, but it affects us all. So if we are all affected by the problem, Why not all of us get together for the solution? And that's what's important here today. So let's not leave today with just saying, yeah, we learned a little bit. It's what are we going to do about it? Because remember, it's our neighbors, it's our brothers, it's our sisters, it's our family members, it's our fellow Fayette County citizens. So let's try to make the solution work. I'd like to introduce State Representative Pam Snyder.
Good evening. I too would like to thank the Secretary for coming to Fayette County for this important event. House Resolution 659 has been passed and it establishes a drug task force. The Speaker of the House, in conjunction with the Majority Leader and Minority Leader, picked 2 members of the House on each side to serve, and I have been honored to be one of those 4 members. So I'm here tonight to listen and learn so that I can carry back to Harrisburg what we might be able to do to solve this terrible crisis we have. You know, drug addiction did not become an epidemic in this country overnight, and we can't eradicate it overnight. But it's forums like this, and Angela is exactly right. We are all in it together, because whether it's a member of our family, our neighbor, a member of our community, it impacts us all, and we have to do something to stop this from happening, whether it's prescription drug addiction or what our young kids are doing. We must stop it. So I hope tonight we can all leave here knowing that we're going to continue to work toward a solution and stop this in our communities. And with that, it is my honor to introduce Representative Deb Kula. Oh, no, I'm sorry, I messed up. Leave it to the Greene County girl to mess up. It is my honor to introduce your state senator for many, many years, and he's smiling because he's retiring at the end of this year. So a great Fayette County welcome for Senator Rich Kasunik.
Thank you, Pam. Thank you, ladies and gentlemen, for that warm welcome. Janet, thank you for putting this forum together, and thank you for inviting me here to participate and, as the previous speakers said, to learn and to find out more about the problem and the issues and how we can address it. Also, thank you to the panel for taking time out of your busy schedules to be here to address this issue that is of epidemic proportions here in the Commonwealth of Pennsylvania. Welcome to Fayette County, Mr. Secretary. We're pleased that you're here to hear our concerns and our issues. We've heard the term many times over and over again, it takes a village. And those words ring true here. I mean, this isn't just drug and alcohol's problem and their issue to solve, or this panel's or the secretary's, but it's all of our problems. It's each and every one of us. It's our community. It's the churches. It's the schools. It's individuals like each one of us. It's individuals like us that are elected officials. But I think most importantly, it's also about family, and it's about parents becoming parents again, and laying down the law and just talking to their children and educating them on the evils and about the problems that may exist right now, and what is happening in terms of our communities. There are people who understand the problem, but there are also people who don't understand the problem. They got their head in the sand, and as Angela said, this affects people from all walks of life, young, old, race, color, religion, and financial background. So it affects each and every one of us. Some of the things we need to be doing, I think, on our end, and I think the members of the legislature will agree, that we need to be doing more. We are rated very low in terms of the state, in terms of statistics, in terms of what we have been doing in Harrisburg and what we've been doing legislatively to bring about change. There are things we need to do, such as dealing with doctor shopping and pharmacist shopping. We also have to give police, firemen, and EMS personnel, and perhaps maybe parents and individuals, the access to the antidote naloxone. This is providing the situation where if there is a drug overdose and we have access to this, that life can be saved, and it can be saved immediately. One of the other things that we need to talk about also would be that here in the Commonwealth of Pennsylvania since 1999, prescription drug overdose has gone up 89%. 89%. Pennsylvania has one of the highest cases of drug overdose. Prescription drug overdose in Fayette County is leading the way, and I don't think that's anything any of us are proud of. So it's going to take all of us to work together with this forum tonight, and as we move forward, we have to do what we need to do in terms of, I think, reaching out to our young people, because those are the ones that we got to educate. Those are the ones that we're going to win over. Those are the ones we're going to convince just to say, stop it now. So with that, I want to thank you once again for this opportunity to be here. And at this time, I would like to introduce the state representative from the 52nd Legislative District, Deb Kula.
Thank you, Senator, and good evening to everyone. As everyone has indicated here today, I too want to thank Janet Kyle from Drug and Alcohol for setting up this forum and bringing us all together. This is a great opportunity for all of us to listen and learn, to listen to the people that deal with this every day, that deal with the problems in different aspects of life. Whether it's the district attorney or it's Dr. Riley or whoever it is, they all deal with this problem in a different way. So to listen to them as to what they see in their everyday life and how we can help them to solve this problem, because they fight every day to solve this problem. We need to help. We need to be there with them. About, I think it was 4 years ago, and I had talked with Secretary Tennis about this evening, there was a bill passed, and I was the prime sponsor of the bill, to expand the scope of practice of pharmacists. Right now, pharmacists can only enter into drug therapy management in an institutional setting before this bill. This bill will now allow physicians to enter into collaborative agreements with pharmacists to do drug therapy management. And I think Secretary Tennis will advise you that this bill will kind of look at who's prescribing drugs. You know, is somebody shopping for different prescription drugs, so that these pharmacists can interact and can be a part of the solution to this problem. I don't think there's anyone more trained as to what drugs can do and the mixture of drugs like a pharmacist can, because that's what they've been trained to do. And I'm sure Mr. Litza from the apothecary will be able to speak to that issue this evening. And a few years ago, we created within the House of Representatives, because we saw a problem within all of the legislature, and the Senate, the House, and the governor agreed that we needed a separate department. We needed a separate department to deal with drug and alcohol, that their main job is to focus on the drug and alcohol issues. And we were able to do that, and we have been very fortunate to have a secretary that is dedicated, that is committed to working with all of us, with all of you, to come up with a solution to the drug epidemic that we're facing right now. And we are very proud to have here this evening the Secretary of the Department of Drug and Alcohol, Gary Tennis. Gary?
Good evening. It is an honor and a pleasure to be here. Thank you, Representative Kula, and thank you for your leadership, both on that important bill with the pharmacists and on your leadership and your support for creating this Department of Drug and Alcohol programs. People ask me, well, why do you need a department just for drug and alcohol addiction, dealing with that issue? Well, drug and alcohol addiction, we know the problem is worse today than it's been in a long, long time, but for decades, drug and alcohol addiction has afflicted 1 out of 4 families in America, in Pennsylvania, and in this county here. 1 out of 4 families. You all have come tonight. It might be more than 1 out of 4 who understand the suffering that occurs in those families as we keep it secret because of the stigma, because of the shame and denial that exists around the disease of drug and alcohol addiction. We tend to keep it secret. Those families that are dealing with the issue tend to suffer in silence. And yet, with this disease, basically, in terms of the resources that we've put to it historically, although Pennsylvania has done better than the rest of the nation, we still provide a fraction of the resources that this problem needs, and it leaves us vulnerable to an epidemic, the kind of epidemic that we're now seeing with prescription drug abuse, the kind of epidemic we're now seeing with heroin abuse, which is really at historically high levels today. Right now, nationally, we fund enough, we pay for enough treatment to treat 1 person for every 10 people suffering with addiction. Pennsylvania does much better, 1 for every 8. Now, one of the questions I had, I came out of law enforcement. I actually worked for the Philadelphia District Attorney's Office as a prosecutor for 26 years. The last 20 years I worked on legislation and policy, and our aim was simple. Like your district attorneys, who I got to meet this morning on the phone, our aim was to bring down crime and make our communities as safe as possible. And as representative doing the legislation for the State District Attorneys Association, which is what I did for 20 years, we pushed through a lot of tough law and order bills. They didn't work. We locked a lot of people up. We drove up our state and county jail populations to really extraordinary levels, but we didn't really have much impact on crime. And it wasn't until 1992 when I had the honor to serve, I was appointed by the old President Bush to be executive director for the President's Commission on Model State Drug Laws, that I reached across actually to the president of the Drug and Alcohol Service Providers here, Deb Beck, and said, tell me a little bit about drug and alcohol addiction. Teach me about that. And what I learned was, and this is to kind of follow up on the comments that were made earlier tonight, 70 to 80% of the people that are in our jails and in our prisons that we're locking up are there with untreated addiction. So the next question became for me, well, then can we really do anything about that? As a prosecutor, when you're in the courtroom and you're trying case after case, what I would do is basically I'd be trying a jury trial during the day. At about 4 o'clock, the judge dismisses the jury, and I got what were called violation of probation or violation of parole hearings. These are people who were who were diverted into treatment, and if they got better, they never came back. I never saw them again. Everybody who had a problem, who didn't do well, all came back to me. So as far as I was concerned, it was a 100% failure rate. But then when I looked at the research, it showed that if we do treatment with clinical integrity, if we give these individuals the level of treatment, the amount they need, long enough and with sufficient intensity, with all of the case management, all the wraparound supports, we can reduce crime by 70%. 70% reduction in crime. And in Pennsylvania, it's even better. We do such a good job with our diversion program that there's going to be a study coming out, actually, that's been studied by Pennsylvania Commission on Crime and Delinquency. The recidivism rate, that's the reoffending rate for people who go into treatment, 16% 2 years after they've gotten out, at which point, for the most part, most people are home free. They're doing well. So 16% recidivism rate for the addicted folks with addiction who are committing pretty serious crimes. For any of us who have worked in criminal justice, whether on the defense side or the prosecution side, those numbers are enough to make your head spin. Those are amazing, amazing recidivism numbers. So here we are. We talked about, one of our speakers, I believe it was our commissioner, was speaking, county commissioner was speaking about the suffering that occurs, or maybe it was Representative Kula, I'm not sure, but the suffering that occurs within the family, the human cost. But picture if we were able to actually give everybody who needed it the level of drug and alcohol addiction treatment they needed, and what kind of impact that could have if we can reduce recidivism by 16%. There is no question in my mind, as someone who has spent his entire life studying the criminal justice system and the last 15 years studying the drug and alcohol addiction treatment system, I am convinced that we could reduce crime in our communities by at least 50%, and we could shut down half of our jails and prisons. Safer prisons, safer communities, fewer prisons, fewer jails, and it would all be cheaper than the way we run the system now. We're here tonight, though, to talk about prescription drug abuse, And really, you can't talk about prescription drug abuse without talking about heroin. This problem cropped up, and for those of you who don't know, I may be telling you something you already know, but in the late 80s, early 90s, there was a very powerful movement in the medical community to say, you know, we can eliminate all pain. We need to make that one of the markers for successful treatment, that nobody needs to suffer any pain anymore. There's actually a very compelling article in the Wall Street Journal in December 2012 by the doctor, the charismatic figure who drove this change in our medical communities. And he basically told everyone, this addiction issue is overblown. Now he knows he probably killed hundreds of thousands of people with this mistake because he didn't bother to really research and look into the issue. What happened was suddenly prescribing over the last 15 years, the prescribing of prescription opioids has quadrupled in America. We're something like 4% of the world's population, and I believe we consume nearly all of the prescription opioids in America. So for many people, there are a couple of problems, there are a couple of issues why the prescription drug problem is particularly difficult. One, there's a sense of, well, particularly among our youth, high school kids, sometimes younger, among our youth, it's like, well, if doctors are prescribing it, it can't be that dangerous. So there's a sense that it's not as dangerous as the illegal drugs. Well, I have spent too much time with parents of kids who've died from prescription drug overdoses, or of kids who started out with prescription opioid addiction and then moved to heroin and then died, to be able too much time to not be able to tell you that that's just flat out wrong. These opioids are very, very dangerous. The other issue you need to know, and again, I think maybe it was the senator who mentioned it, everybody has different tolerances. Some people have the ability to take this and maybe be less likely to get addicted, but many people, because there's actually a genetic marker, many people have this genetic marker that makes them susceptible to getting addicted fairly quickly. And then what happens is the usual scenario, once you're addicted to prescription opioids, that addiction continues. There can be drug-seeking behavior then to try to get more of them. And ultimately, as left untreated, the addiction continues, it gets worse, and then sooner or later, the person starts going for heroin because they can't afford, maybe their lives have fallen apart, maybe they've lost their jobs, maybe they've sundered their relationships with their families, and the constant quest to try to avoid that terrible sickness that comes when you quit. So this is kind of the scenario we have. There are many ways that we're trying to address that with the problem. I think Representative Kula's legislation that she got through is going to be a big help. We have prescription monitoring program legislation, and that legislation is now over in the Senate. There are a couple of bills that have gone over to the Senate. Both bills are excellent. We need them badly. Every state that has passed a prescription monitoring program bill has found a strong impact on a reduction on the number of new people getting addicted to prescription opioids and other addictive prescription drugs. Another thing we've been looking at is, well, how do we change up prescribing practices? And one of the things we did, some states have really been working on this issue, and we have actually, the Corbett administration has directed me, and we've pulled together doctors from all over the state. We've had 2 kind of marathon meetings, and a week ago, this past Monday, we actually settled on our first draft of the Pennsylvania prescribing guidelines that we're sending over to the Medical Society. We're going to be sending it over to the Joint State Government Commission that's working on the issue, and we think these guidelines are going to have a big, big impact on prescribing. They're based off of what was done in Ohio and implemented about a year ago. We think they're even a little bit stronger, and we believe, based on what's happened in Ohio, that they're going to reduce the number of new people getting addicted. So prescription monitoring programs, prescribing guidelines for doctors are going to make a difference. The other thing is we have a take-back program, and I was having a good discussion with your district attorney about exploring the possibility of these. We have these available, and we've been placing them around the state. One of the things we know is that sometimes our adolescents will steal these from medicine cabinets, and they take them. They think these are going to be fun to take and see what happens. Sometimes the combinations are lethal. Very often it ends up with individuals getting addicted and then having their lives deteriorate. By the way, just so I'm 100% clear about this, left untreated, drug and alcohol addiction progresses, it's always progressive, and it will always be fatal if it's left untreated. You might end up have a few passages through the criminal justice system on your way to an early death, but it is a fatal disease. It needs to be treated. So this is very, very serious, and I'm sure all of you in this room today wouldn't be here if you didn't already know that, but I just want to underscore that that is the case. So we're working on the take-back program, the prescription monitoring program. There are other innovative ways too. We're trying to get more in a time when there are scarce resources, because we're still coming out of the Great Recession. But we're trying to find ways to bring more resources into treatment. One of the ways we've looked at is looking at individuals that we divert into treatment at sentencing and seeing if we can save the county's money by putting them into treatment within a couple of weeks of arrest instead. There are all kinds of advantages to that. The individuals don't get kind of inculcated in criminogenic thinking by being in the county jail. They're more highly motivated to do well in treatment because they're looking at a sentencing, and we save dollars for our counties, and those are dollars that we're asking our county commissioners to then use to fund more drug and alcohol treatment. Some counties, I'm looking at Colleen Hughes in Westmoreland County, they were already ahead of the marker, already doing that, but we now have 7 or 8 more counties added to it, and that's something that we're interested in trying to do everywhere and across the state. Just to kind of highlight a few little facts about this, right now, today, in the year 2014, 3 million teenagers this year will become new prescription drug abusers. 3 million American teenagers. This is a big issue. I've talked about access to treatment. The Governor's Healthy Pennsylvania program, which if it's accepted by the federal government, and we're optimistic that that will happen, will treat those with drug and alcohol addiction as medically frail, and will put them on Medicaid. Not in the private choice option, but on Medicaid. And our Medicaid benefit, because of legislation I'm pretty sure Senator Kucinich voted for a decade or two back, has a strong, strong drug and alcohol treatment benefit. That will be a dramatic expansion in access to treatment in Pennsylvania. So this is a critical issue. I often refer to drug and alcohol abuse, whether it's prescription drug or heroin or alcoholism, as an invisible giant that causes extraordinary suffering in our communities and drives costs across every department in our state and drives costs in every one of our counties. Your commitment in showing up here tonight is the kind of commitment we need to begin to really develop rational policy in drug and alcohol and really address this problem with all of the forces that we can muster. I want to close because stigma is an issue. I want to just talk a little bit about stigma and how much it affects how we think about drug and alcohol abuse. There was an article in the Philadelphia Inquirer, and this is kind of burned on my memory. It was an excellent article about the overdose problem that's occurring, and it's not just here, it's everywhere. And the first comment on the blogs that occurred, this is kind of the underlying attitude, was it said, and this is a little shocking and sickening, it said, overdose is nature's way of taking out the trash. That is the kind of attitude, that issue of looking at this is a way that individuals suffering from addiction, it's because they're bad people, that it's really time for us to move beyond. One of the signers of the Declaration of Independence, one of our Philadelphia residents, Dr. Benjamin Rush, nearly a quarter of a millennium ago, 250 years ago, was the first one to see they had terrible alcoholism problems in colonial times. They would put people in stocks. They tried to find one way or the other how to punish them out of their drinking problems. 240 years ago, Dr. Benjamin Rush said, maybe this is the wrong paradigm. Looking at this as a doctor, I think this is a disease. We need to treat this as a disease and stop treating it as a moral issue. And it began a process that still goes on today. Still, in the city of Philadelphia, where Dr. Benjamin Rush lived, we have this stigma. It's time to let the stigma go, although there's certainly personal responsibility in getting better from this disease and getting into the disease, as there is with heart disease and any other and many other diseases that are caused by bad behaviors. We owe it to ourselves, we owe it to the families, we owe it to our pocketbooks, we owe it just as from one human being to the other, that we really take on this disease and treat this disease as we would any other, and make sure that those who are in need of treatment get the treatment they need. So thank you so much for listening to me. Thank you for showing up here tonight. And I think you've got a very prestigious group here, and I look forward to hearing what they have to say. Thank you.